Preparedness of unlocked COVID-19. End of last month, the government of India has announced Unlock 4.0, and following that, the Tamil Nadu government has given guidelines with lot of relaxation about what is open and what is closed. All shops, places of worship open till 8 p.m. Shopping malls, large stores with 100% staff. No more lockdown on Sundays. Free travel between districts. Tea stalls, restaurants open from 6 a.m. to 8 p.m. Takeaway till 9 p.m. Factories and IT parks can function with 100% staff. Non-critical staff can work from home. Clubs, hotels that offer accommodation can function with adequate SOPs. All parks and playgrounds open for physical and sports training. Spectators won't be allowed in playgrounds. Private sector, government offices, banks functioning with 100% staff. Cinema shooting with 75%. New protocol for testing and quarantine. Flights to Chennai increased. Intra-district bus service resumed from September 1st, Chennai Metro from September 7th. What remains closed? Schools, colleges, research institutions, academic institutions, cinema halls, swimming pools, amusement parks, beaches, auditoriums, zoos, museums, tourist places, and suburban trains, religious, social, cultural, political, educational activities, and celebrations. Now, we come to the part of prevention, because prevention alone is the present weapon, as there is no cure yet and also there is no vaccine as yet. Even the Japanese have decided to coexist with the new coronavirus. They called it the new life model, calling that people to be prepared to follow this model for an extended period of time, to live and work with the virus. The state recorded till Thursday 5 lakhs 25,420 positive cases, and today it is 5,40,619, and children form around 20,000, half of them being boys and girls. About this virus, which is around 3 micron size RNA virus, survival of this virus has been studied, and it is found to survive for 4 hours in the air, droplets for 24 hours, fabrics less than 8 hours, less than 5 minutes in 70% alcohol and bleach, over copper 4 hours, cardboard 1 day, wood and glass 2 to 4 days, paper 4 days, stainless steel and plastic 3 to 7 days. Now, soap in water remains one of the most valuable medical interventions. Soap molecules disrupt the chemical bonds that allow bacteria and viruses to stick to surfaces, lifting them off the skin. Micelles form around the particles of dust and fragments of viruses and bacteria, suspending them in floating cages. And when you rinse your hands in water, all these microorganisms that have been damaged, trapped, and killed by the soap molecules are washed away. Pathogens lapped in lipid membranes include the coronaviruses, about which we are interested, and other viruses like HIV, hepatitis B, C, herpes, Ebola, Zika, dengue, and numerous bacteria. Now, this is the mechanism. The coronavirus has a membrane of oily lipid molecule which is studded with proteins that help it to infect cells. Spike proteins and the lipid membrane is shown. Now, the soap molecule has got a hydrophilic end and a hydrophobic tail. Soap destroys the virus when the water-shunning tails of the soap molecules wedge themselves into the lipid membrane and pry it apart like a crowbar. The soap then traps the dirt and fragments of the destroyed virus in tiny bubbles called micelles, which wash away in water. That is how it helps. Sanitizers also act similarly by destabilizing the lipid membrane, but cannot easily remove the microorganisms from skin. There are also viruses that do not depend on lipid membranes, infect cells as well as bacteria, but protect the delicate membranes with sturdy shields that cause meningitis and pneumonia and skin infections. Examples being hepatitis A, polio, and rhinovirus, But it has been found that vigorous scrubbing with soap and water can still remove all these microorganisms from the skin, which is partly the reason why hand washing is very effective, more effective sometimes than a sanitizer. But sanitizer, alcohol-based sanitizer is a good backup when soap and water is not accessible. Now, regarding COVID-19, it has been months since into this pandemic, and there is no respite. Each day, the cases are increasing. There is no definite treatment or vaccine. So, the management is now movement restriction, creating awareness, physical distancing, and measures to improve the personal hygiene. And these are the only means to curb the spread of disease. Prevention is at three levels: individual, community, and institutional. Prevention at the individual level, maintaining good physical distance, preferably more than 1 meter. CDC guidelines 6 feet is recommended. Washing the hands as mentioned previously with soap and water for 20 seconds. Avoid unnecessary touching of mouth, eyes, and nose. Avoid crowded places and gathering. Covering the mouth and nose with mask when in public or when going out. Cleaning and disinfecting the frequently touched surfaces like doorknobs, light switches, mobile phones, table surface. The routine use of gloves is not recommended except when caring for a sick patient at home. Hand washing is shown here, all the steps about which all of you are very familiar. And mask, the do's and don'ts, make sure that one can breathe through it, wear it whenever going out in public, make sure that it covers the mouth and nose, and wash it after using. It should not be used in children under 2 years. Surgical masks and other PPE intended mostly for healthcare workers. Stopping COVID by using the hands, washing them often, elbows for coughing into it, face, never touch it, feet stays 6 feet away, and when the person feels sick, to stay at home. Next, we go into how to prepare when we want to run a clinic. Adequate ventilation should be the main criteria. The doors and windows should be kept open. Better not to use an air conditioner. Unless you have an exhaust, in which case you can use it. Provide hand wash, soap, and sinks at the entry. Adequate alcohol-based hand rub should be made available at the point of entry. Placing chairs in the waiting area, minimum at least 3 feet. Create separate spaces for sick and well patients. Remove all the toys, reading material, and others from the clinic. Registration staff should wear the triple layer mask and gloves. Provide more telemedicine appointments, schedule prior appointments to avoid crowding at the clinic, and if possible, if they come by car, they can wait till their appointment is given. Limit the number of attenders, doctors to wear N95 mask and gloves, and if they feel they can wear an apron also. Avoid aerosol generating procedures, and after the patient leaves, the surface should be cleaned and all the touch surface must be cleaned using the disinfectant. At the point of entry, there should be a staff to direct the patients to perform the hand hygiene before entering the clinic, and they should perform the thermal screening. Ask patients about their symptoms and direct the sick patients with symptoms to a separate waiting area. Provide patients with face mask to cover the mouth and nose. Maintain at least 1 meter distance. In the isolation, screening, and triage area, the distance should be at least 2 meters. Environmental surface cleaned with, that is, metallic surfaces cleaned with alcohol, non-metallic with 1% hypochlorite or 5% Lysol. Sprays can be used, but aerosol may be generated, so caution should be practiced. 1% hypochlorite should be prepared every day for use. Actually, floor, railing, everything should be cleaned by using the 3-bucket system, mopping first with detergent solution and water, then with 1% sodium hypochlorite, moving from the farthest end, then towards the door. Frequency, high touch surfaces like doorknobs, phone bells, bed rails, stair rails, light switches, and wall round the toilet should be done every 3 to 4 hours. Whenever there is a COVID suspected or confirmed cases, every 2 hours also is preferred. Low touch surfaces like mirrors, etc., at least once a day. Cleaning staff should wear proper PPE. Disposable gloves should be removed and discarded if damaged. Cleaning staff should wash their hands with soap and water after removing the PPE. This is the slide to show the 1% solution is prepared from either 5 or 10%. How much is to be mixed with water. For 5% solution, 200 ml of the solution mixed with 800 ml of water will give 1%. Similarly, with 20% bleach, 50 grams in 1 liter will give 1% solution. Regarding school, the general principles are public health social measures applied for schools. We should ensure the continuity of safe, adequate, and appropriate educational, social learning and development of children. Minimize the risk of transmission within the schools and settings among the children and among the teachers and staff. Guarding against the potential for schools to act as an amplifier for transmission of infection. Integrating the school-related public health measures that is also implemented at the community level. If there are no cases, the consideration is schools can be open and implement the COVID-19 prevention control measures. Even if sporadic cases are there, the same can be applied. If there is cluster transmission, most schools remain open and can implement the COVID-19 prevention and control measures. And they may consider if there is an increase in number of cases closing the schools as a part of a public health social measures. Whenever there is a community transmission, the approach should be a risk-based approach. Closure in case there is a large number of cases. At the school level, when schools are fully or partially open, hand washing strategies, including washing with soap and water, as mentioned, should be encouraged. Schedule the regular cleaning of environment, including the toilets with soap and water and disinfectant. Limiting the time of exposure or direct physical contact like physical education exercise, sports and other physical activities. We have to put in place respiratory and hand hygiene and physical distancing measures during transportation in school buses. Maintain a safe distance of 1 meter between everyone present at school. Increase the spacing between desks. Move lessons outdoors or ventilate rooms as much as possible and avoid air conditioners. Enforce the policy of staying at home if unwell. Consider daily screening of body temperature. At the administrative level, attendance cohort in keeping students and teachers in small groups referred as bubble, capsule or safe squad. Staggering the start, school breaks, bathroom, meal and end times. Infrastructure reorganization of the spaces. There should be a separate entry, exit, hand washing facility. Maintain clean environment by cleaning often. Ensure that the ventilation is adequate. And one should reorganize the school transport. Sharing of information should be there between students, teachers, and parents. Mental and psychological support, feeding, and immunization should be taken care of. Screening and management of sick children, students, and other staff. Checklist is to be prepared. Underlying medical conditions and vulnerabilities to protect the student. Recent illness or symptoms suggestive of COVID-19 and to prevent spread to others. Daily screening for history of fever. Ensure that students with contact history to stay at home for 14 days. Communication. Ensure frequent communication and messaging so that it reassures the parents, students, and teachers. Inform parents about the measures taken and ask cooperation in reporting cases occurring at home. And the children must be advised to stay at home and inform the school. Ensure that children who have no access to classes have internet facilities. Monitoring of school operations and establishment of surveillance programs. Effectiveness of symptoms reporting, monitoring, rapid testing and tracing should be done. Effect of the policies and measures on the educational objectives and learning outcomes must be assessed. Effect of policies on the health and well-being of children and staff must be assessed. Trend in school dropouts after lifting of the restrictions must be assessed. Number of cases in the children and staff in school and frequency of school-based outbreaks in the area must be assessed. Assessment of the impact of remote learning on the learning outcomes and formative assessment. These are some of the pictures from CDC where the children will be able to understand easily whether they feel well and when they should stay at home, and about hand washing, so that they learn and apply it. Schools are not only centers of education in India, but take care of nutritional physical needs of children through various schemes. The future of the education system will involve more of e-learning platforms with policies to maintain the privacy of children and newer modalities to take care of nutrition and fitness with significant changes in the infrastructure. Now, there are a lot of stress factors in this pandemic. The children, they are cut off from games and playtime, sense of isolation, difficulties in learning, changes in learning and teaching, family income and employment fears, or any death or in the family, behavioral issues, fear of disease, exam results, etc. For this, the Ministry of Human Resources have emphasized on the need to provide psychosocial support, and a working group was set up in consultation with experts and stakeholders, and that is the genesis of Manodarpan. Here they have done this to facilitate sustainable psychosocial support system in the educational arena beyond the COVID-19. It contains the advisory group, which will give the guidelines for school, colleges, teachers, parents to promote mental well-being. There will be a web page with advisory, motivational posters, practical tips, toll-free helpline, counseling resources, and resource center. Next, shopping malls. The persons above 65 years and persons with comorbidities, pregnant women and children below 10 are advised to stay at home except for essential and health purposes. Entrance to have mandatory hand hygiene, especially if the hand wash with soap and water is available, that should be encouraged. Then, if not, sanitizer, and then thermal screening provisions. The face cover mask should be worn at all times inside the shopping mall. Only asymptomatic customers should be allowed. Preferably separate entry and exit for visitors, workers, and goods and supplies should be organized. Physical distancing of minimum of 6 feet when queuing up for the entry and inside the shopping mall should be advised. Effective and frequent sanitation within the premises should be maintained with particular focus on lavatories, drinking water area, and hand washing stations. Gaming arcades should remain closed. Children play areas should remain closed. Cinema halls inside the malls will be closed. Now, take home messages. Be careful, not careless. Be happy with safety. Wash hands frequently. Don't touch mouth, eyes, and nose. Keep physical distance of a minimum of 1 meter.